People who work in hospital, what is the worst thing you have seen a patient go through? I had a 94-year-old woman who had been beaten by her niece so horribly that she was intubated and in the ICU. This woman was in pure agony, and her family wanted to do everything for her. Come to find out, they were keeping her alive and collecting her Social Security check. While cleaning her up, she grabs my arm and holds it tight. Huge tears well up in her eyes. She looks at me and mouths over the ET tube. "I want to die. Please let me die." That night, I sobbed the entire way home. Edit: why I did not expect this receive so much attention. Unfortunately, I don't know what happened to this woman. This was one of my last days in the ICU. I was a young nurse, and emotionally I could not handle working there, and this was the last straw. I had nightmares about being at work and trying to take care of patients. I would wake up and see my husband laying next to me, and it took me a minute to realize he was snoring and not a patient who was on a ventilator. It sounds silly, but it's horrifying if you actually think you're in that situation. I wish as nurses we were able to talk about what we experience on a daily basis, but because of HIPAA we aren't allowed. Years later, I am now an ER nurse, and I love it. I see awful things quite often, but I have a better way of coping with those experiences. Fuck that. That poor woman. My whole career has been healthcare, and I can relate to a lot of stories here. And although emotional, still feel some professional detachment, but this made me cry. I cleaned the rooms of the ER in my local hospital as a summer job. This woman in her 40s was dying from cancer, and she had a room in the ER for a couple days to wait for another room in another service. She looked fine for someone who was dying. I mean, she was bald and looked ill, but she was nice and lovely to be around, cheerful, etc. One time I was cleaning the corridor when I heard cries from her room. I opened the door, and there she was on the floor. She fell from her bed after trying to walk to the bathroom. I helped her to the bathroom as she was crying, in pain and in fear because she realized she could not walk anymore and that her end was coming. She broke my heart. It was the first I realized where I was really working. I helped clean up a cancer patient's room after an unfortunate bowel movement ended up all over her room and bathroom. I did my best to assure the patient that it was no big deal, but I could tell she was embarrassed, but too tired to say much. She thanked me afterward when I was getting ready to leave her room. I could see in her eyes how much it meant to her that I'd been so caring and understanding. I'm very empathetic, so feeling what she felt and feeling what she was going through just about broke me. I left her room and took care of my cleaning supplies, and as soon as I was alone, I just busted out sobbing. I saw the courage in her eyes and knew she was a tough lady. But that in and of itself made me cry too for some reason. It got seeing that same tough courage in my mom's eyes when she was battling cancer, so it really hit home for me. I heard afterward that the patient whose room I'd cleaned up had passed away, and I cried my eyes out then too. Working a hospital is fucking tough. People sometimes don't understand the clinical detachment that providers can have, but if you don't have it to some extent, then your emotions can break you. Provider burnout is a real thing. Edit: thank you for the gold, kind stranger. ICU: lady who was roughly 40 paralyzed from the chest down due to car accident years prior. Currently on a ventilator through a trach and had a permanent feeding tube inserted in her stomach. When I saw her, she had a bleed in her stomach that was seeping out through the tube, and she kept pulling out her trach in an effort to end it all. They ended up having to sedate her pretty heavily to keep her from repeatedly pulling the tube out. Seeing her pulling the tube loose, and watching her actively begin to suffocate with a totally blank look in her eyes was chilling. As nurses and doctors as well, we really need to get better at end-of-life discussions. So many people get horrible things done to them because the family wants everything done for them, when a simple explanation of heroic measures and why they wouldn't be beneficial to that person could change things. Same with things like humanely withdrawing care. If someone doesn't want to live anymore, 9 times out of 10, we can't make their bodies live anyway. It pretty well cemented me having no desire to ever work in the ICU as a nurse. I just felt so bad for the lady. She clearly was over-suffering every day, and she was only 40 or so. It's hard to know how to feel about a situation like that. There's just no easy answer. A guy got in a car accident and broke his back and was told that he'd never walk again. When they tried doing therapy, he started wiggling his toes, so some hope came back into the picture. The transport dropped him when transferring him from the bed to the stretcher and broke his back all over again. That was 20 years ago now, and he has never moved a toe again. Don't forget to lock the bed or brace the stretcher kids. Edit. Bonus points, I also forgot about the little boy whose brother jumped off the top of the bunk bed to help him do the splits. Screams I will never forget. I was in the hospital after a car wreck many years ago. It was a pretty bad one. The first few days, I wasn't expected to live. They finally decided that I might, and maybe they should attempt to save my leg and put my face back together. They came in to transfer me to surgery and somehow dropped me between the bed and gurney, scraped me up, and took me down in the elevator to surgery. As we're leaving the elevator, they start pushing the gurney and left the stand with my catheter bag in the elevator. Luckily, someone had just got in the elevator and yelled HEY. I was hyperventilating badly after all this when I got into surgery, so they put me out right away. The doctor mentioned it later when he came in to talk to me. I told him about getting dropped, and he said that I must have imagined it. They would never have dropped me. The patient in the next bed said bullshit and told him all about it. He stormed out, and I think a couple people may have gotten fired. I must have imagined it, kind of similar story. My father woke up on the operating table despite being given anesthesia. My mother could hear his screams and demanded the doctors tell her where her husband was. They claimed he never woke up and nothing happened. Makes me think how many doctors lie about stuff like that. Saw a couple lose their baby very suddenly one day before the due date. Saw a man get all of his affairs together and quit his job with a rare terminal illness. Then live. Second bit reminds me of Breaking Bad, where Walt reminisces on the day he should have died. I haven't seen the show, but I've been dying to. One TV, lots of compromise. He told his family, said goodbye to his kids, left a well-paying job with great benefits after decades there, sold off the estate. Then he made it through, left only with time to pick up the pieces and start his life over from the ashes of his old one. Not sure how the family felt about him giving up everything, but he figuratively salts the hospital grounds whenever he comes back to make sure it isn't recurring. Got sent to the pediatric ICU to watch over a 16-year-old who tried to shoot himself in the head in a failed suicide attempt. He broke the bones that hold his eyes in and lost all function of his eyes for obvious reasons, and also shattered the part of the skull holding the brain out of his upper sinus. He was very confused and obviously terrified. He had just learned he was going to be blind for the rest of his life and need a new skull fragment put in to keep his brain in place. On top of all of this, his divorced parents were fighting. The dad blamed the mom because he used her gun. The mom then refused to let the dad visit by not giving him the special code you need to get on unit. It was the single most fucked up night I've worked, and I refused to go to that unit ever again. The most awful thing my paramedic friend told me was a teen suicide that was actually a cry for attention. This girl had had a huge fight with her dad and decided in the moment, I'm going to kill myself or I'll scare the shit out of them. She took a whole box of Panadol. Nothing happened. Later that night / next day, she starts feeling really sick, so she told her parents what happened and they called the ambulance. Unfortunately, paracetamol starts having negative effects when it has already been absorbed into the blood and is damaging the liver. If you don't catch it early, you can't minimize the effects. There was nothing the hospital could do. They had to explain to the family what was going to happen and then wait for her to pass. The girl just kept apologizing to her parents over and over. She just wanted a trip to hospital so they would listen to her. Paracetamol is incredibly dangerous and not enough people know about it. I was in my second clinical rotation as a nursing student. We were assigned patients, and the patient I was assigned to was a grumpy old guy who was 79. He had a good sense of humor, but you had to tread carefully around him. He had chronic pain and was diagnosed with colon cancer. His son would visit in the mornings just in time to talk to the doctors doing their morning rounds. His wife had passed a few years earlier. I was helping him get ready for breakfast when the doctor walked in. This was pretty typical, but he was anxious to see the doctor today as he just had a bunch of tests done and was hoping to hear some results so he could be discharged to go home. I usually just finish up whatever I am doing and leave so that the patient and doctor can talk privately. That morning his son was not able to make it in, and my patient asked if I could stay in the room with him to hear everything, in case he missed something. I said sure, no problem, as long as the doctor is okay with it as well. Some doctors don't like dealing with students. The doctor just got right to the point. The cancer had spread, and there was nothing more they could do. The palliative team would be coming to meet with him this afternoon to discuss where he could be transferred to during his final days. My patient thought the doctor was joking and started to laugh, and then just sat there with a completely blank look. As a student, I was not prepared to know how to comfort someone in that situation, as it was something I didn't have experience with. I felt awful because 10 minutes before he got this news, he was telling me he couldn't wait to see his cat once he got home. For the next week, he did not get out of bed, refused to eat and take medication or shower. And then I came in one day and he was transferred out. I've witnessed this a few times. Patients being told by the doctors that further treatment is no longer recommended. Just last week, I stood a few feet away from my patient when the doctor told him that she didn't think more chemotherapy was going to help him. On the way back to the nursing home, he said something that struck me so hard, I actually wrote it down. Now it's time to have fun dying. I like a challenge, I'll fight it to the end. Holy shit, I think I'll actually have that written on my tombstone. Word to live by. Work in a mental health hospital. Fucking dementia. Horrible disease that affects the people you love more than you because on the good days, you don't know you have it. I've seen people screaming out for their wife/husband who died years ago. What do you tell them? They're dead? Why put them through that again? Do you lie and say they're on their way/are shopping or something else, knowing that will placate them for 10 to 15 minutes until they ask again? Fuck dementia. I don't think there's an illness worse at it. Wow, my first gold. Thank you. This really blew up. Went from 120 karma to 7K. I know it's not much, but I've only just decided to stop lurking and start posting. Thanks, guys. This was the worst part of working in the nursing home. I had one lady, Max, and man was she just the sweetest. But her mind was going. She lived there with her husband, and he died first. Max was 96 and always asking where he was. She was happiest to be told he was bringing flowers or candies or something and had see her soon. We would sneak those items in her room at meal times so she would think he came and she just forgot about seeing him. She was happy and it was working well until she got a new CNA, Heather. Heather deserves to die in a fiery, agonizing pit. She got pissed that Max asked about her husband. So Heather told Max that her husband died 10 years ago and was never coming back. So just get over it already, you overgrown toddler. The sound that came out of Max will haunt me for the rest of my life. Max was strangely lucid afterwards. Even when she was out of it, she was sullen and depressed and would say she didn't understand why. After that day, Max stopped eating, stopped drinking, stopped playing dominoes, stopped walking around the halls. She never leaves her room or socializes. She stopped asking about her husband. She got very sickly and was declining fast. It was at this stage that I left that home. I filed a formal complaint against Heather and left for other reasons. I don't know if Max ever came out of it or if she wasted away in there. It was the most heartbreaking thing I've ever seen. Heather is the worst kind of person there is. If Max died, I'm holding Heather personally responsible. I don't care if it's a lie. Max was happy, and I truly feel she would still have been doing good if Heather had kept her fucking mouth shut. Why the fuck tell her? And all the time, I worked in dementia care. The motto I worked with was, it's easier for me to go to their world than it is for them to come to mine. I volunteered in a children's hospital throughout high school. There was a 16-year-old patient there who had spina bifida and had no feeling beneath the waist. He had routine surgery and expected to be in the hospital for about a week. The worst thing I've ever seen was the look on his face when he told me that the doctors had found MRSA on both his legs, and he wouldn't be leaving the hospital anytime soon. Hospital trips are kind of funny. The first week, everybody wants to visit you, but after that, guests seem to taper off dramatically. I remember him stating that the hardest thing for him was the lack of social support beyond his family, and to a much lesser extent myself, as this was like the year before Facebook really being a thing that everybody had. Happy ending though, he eventually did recover from MRSA after spending around 6 months in the hospital. My daughter has a 3-year-old friend. She wasn't showing up at daycare. It turned out she had cancer. Her mom gave us her number to keep on touch. I was so scared to call and find out she was going to die. It was maybe 3 months later of no contact before I talked to an older lady one day whose husband died, and everyone was so scared to talk to him he died alone with just his wife. She said, "Imagine if your daughter had cancer and none of her friends visited her." My heart broke. I called her mom that day. Her daughter is back in school now and doing well. Please don't forget about people just because they are sick. In clinical on a burn/trauma unit, guy had 3rd-degree burns on 80% of his body. He had very little skin left. I could actually see part of his tibia. Fingertips were necrotic. He was heavily medicated, but still, I can't even fathom the pain. If he made it BC, he was quite septic last time I was there. I now work in the NICU. Most of the babies end up doing pretty well and going home eventually, but some aren't so lucky. I could go on about the medical stuff, but really the worst is when their parents don't give a shit about them. Some parents live far away and have other kids to take care of, so it's understandable if they aren't there every day. But then there are others who never call, never visit, and no one can track them down. So the kid ends up being discharged to foster care. It just burns deep in my soul sometimes. One day, I might hand a perfectly nice couple their baby to hold one last time while we withdraw life support. And the next day, I'll be trying to soothe a baby withdrawing from the drugs his MIA mom took. Despite the challenges, I still love my job, though. My son is in NICU, and it kills me he isn't home. I wonder sometimes if he dreams of my voice and my heartbeat. I'm counting the days till he comes home and drive almost an hour round trip to see him daily. I can't imagine forgetting him and leaving him there. Edit. Thank you everyone for your kind words. I really needed them right now. I have seen many people die, but the worst one by far was a man with active bleeding, hemorrhaging from his esophagus due to long-term alcoholism. This was many years ago, and there are better ways to treat it now. But at the time, the treatment for this kind of hemorrhaging was putting an inflatable tube down the throat into the stomach. It was attached to some kind of helmet that you had to put on the patient afterwards, which was tough. You would inflate the tube to stop the bleeding, but also aspirate the blood out of the stomach with a huge syringe. Just putting it in was horrible. The patient was so scared. There was blood everywhere. He was vomiting blood, shitting blood. He couldn't hardly talk due to the bleeding. This was in the ER. We got IVs in him. Started transfusions pouring into him as fast as they'd go. We worked on him for a long time, but he didn't make it. What I remember is how hard he fought, how scared he was, and how much blood there was. And this was before rubber gloves were worn for everything. I just threw out my uniform. Everyone's shoes were soaked. I never saw anything like it before or since. Don't become an alcoholic. Don't get cirrhosis or esophageal varices. It's a bad way to go. 19-year-old who was 38 weeks pregnant stabbed 9 times in the chest. Emergency C-section was done in the trauma bay. The doctors were losing their shit. There was blood everywhere. Everyone was losing their shit. Mom died a few days later, and I am not sure if the baby made it. Last I heard about it, the baby was in NICU having frequent seizures. I think I've told this before. Hospital I used to work in had an eye clinic with some laser surgery rooms. Patient with a common surname, let's say Smith, had an eye exam and is told to make a follow-up appointment. He's waiting in line to make an appointment when, from the other side of the clinic, a nurse calls for Smith. He walks over to her and says he's Smith. She leads him to one of the laser rooms. The MD performs the procedure. When they're done, the patient asks, "What did you just do to me?" Oops, I've only had surgery once, and I guess this procedure he had may not have really been surgery. But I remember after they wheel me into before putting me under, they asked me to recite my full name, birth date, my doctor's name, and what procedure I was having. Seemed silly at the time, but now it makes perfect sense. I was a nursing student in ICU. An older guy had been beaten and raped so badly that the doctor's official diagnosis was abdominal catastrophe. It was the first time I understood how someone could be devastated at the prospect of recovery. The look in his eyes when he found out he would have to live with severe, permanent complications stayed with me for years. I remember thinking all the trauma therapy in the world wouldn't be enough to help him. Homeless guy came into the ER with a tooth abscess. The infection was making its way to his heart. So he split his neck from ear to ear to get as much infection out as we could. We kept the incision open to monitor the healing. Well, the fun part came when we had to do a CT scan. I had to hold this dude's head as we moved him over. It felt like his head was going to detach at any second. He ended up dying. Mandatory don't work in a hospital, but I did undergo some serious cancer treatment in my early 20s. Cancer sucks. Everyone knows that. But anytime I felt low about my situation, I took a look around the infusion center for chemo and saw kids as young as 5 or 6, and that clearly were numerous cycles further into chemo than me. There wasn't much privacy in the infusion center, and you didn't have much to do but people watch. God, the look on parents' faces will haunt me until the day I die. There are a lot of things from that time in my life I will never forget. One thing that sticks out is just how awesome the nurses on the chemo ward were. One woman in particular had a way to bring joy to anyone and everyone just by being herself while she did her job. She was as black as midnight with a respectably large afro and a high Cockney British accent. This was in the States. If heaven ever did speak, this woman was its conduit. So to answer OP's question, kids slowly dying of cancer and seeing their families look on without hope as their child slowly withers away. Also, there's rarely a week that goes by that I don't think about that nurse. I never gave her the proper thanks she deserved, but I hope she knows how amazing she is. I had a friend who had to go through chemo for cervical cancer, who said her first treatment was really painful and she couldn't help but shed some tears during the infusion. She said there was a little girl about 4 years old across from her. She had a small daughter at the time too, and asked her if her infusions were painful. She said the girl replied, "Yeah, it hurts. So what?" and went back to looking at her picture book. It really left an impression on her. Well, I'm going to try and lighten the mood in here and be a bit self-indulgent at the same time. The nurse that worked in the hospital said that this is one of the funniest things she's seen. I had brain surgery and a huge wound about 10 inches across my skull. It wasn't stitched. It was stapled. I hadn't had a dump for about 3 days after the surgery, and the nurses gave me some tablets to soften my stool up and coaxed me out of bed to try and bust the shit out. I sat there and strained and slowly, but surely the turf inched its way out. But the problem was it was like concrete, and after straining for so long, I fainted and fell forwards onto the bathroom floor. Anyway, the nurses came in and found me face down and a big turd protruding from my arse that was sticking out of me like the Tower of Pisa, fully intact. So apparently anesthetic can back you up a bit. The nurse put a glove on and literally pulled the iron bog out of my arse before they cleaned me up. She said it was one of the most satisfying things she has done, and even better that picking Esty get boyfriend's blackheads. Legend. Wasn't employed by the hospital, but worked as an interfacility transport EMT at the time. Had one patient that had terminal bone cancer and was morbidly obese. I was transporting her from the hospital to a radiation appointment. I developed a rapport with her, and she opened up and told me how she is just buying maybe 6 months by treating the cancer. Otherwise, she would have died already. Well, as some of you may know, bone cancer is one of the most painful and terrible ways to die. So for her to extend that misery for just a little longer so she could experience life and see her family a little longer was very inspirational. We get to the facility to do the radiation treatment and are told it should only take about 45 minutes. Then we get to the room where the magic happens, and the table she's supposed lay on is the same size a small adult would use. They have no modified version for morbidly obese adults. The only way to keep her on are extra straps they use to tie her down to the table. They constantly have to stop the procedure to adjust her for comfort. 2 hours in her fentanyl she was given at the hospital has completely worn off, and the facility isn't authorized to administer meds like that. Appointment ended up taking about 4 hours longer than it should have, and she was just miserable, but still so sweet and apologetic the whole time. I felt awful for her, and after it was done, there was a huge sense of relief in her voice. I told her how inspirational she was to me to see how resilient she was being. I've been a nurse a few years and thought I was pretty awesome. A patient in the ICU was unstable with a heart problem, but with meds was pretty stable when my shift started. She was a DNR with heart failure. The family had been there for days. Husband, adult sons, daughter-in-law. They were the nicest folks. They were contemplating going home for a few hours to shower, eat and rest. I told them her heart rhythm looked good. Go home and get some rest. I took their cell phone numbers and told them if anything changed, I would call right away. Pressure kept dropping and dropping. I got them on the phone an hour later and told them to come back. I spent 2 hours desperately trying to keep her alive, and they ran back in the door 5 minutes after she was gone. I couldn't stop crying. I felt so bad. There was no professional boundary there at all. We all knew a young, stupid nurse took their last moments with their mother, and mom died alone, with a few scattered staff doing what they could, but without her family by her side. I had a patient who was an escaped sex slave. It was a younger individual in their 30s who was dragged into their situation through a drug addiction and was actually supposed to be killed because they were sick, but ended up finding a way out somehow and landed themselves in a local psych ward. Because of their physical health, they were sent to the hospital where they died not long after. I forget why. And as I was helping to clean up the patient for family viewing, I saw their rectum was stretched to a point I've never actually seen before or after. They had been waiting until their condition improved to schedule surgery. It was awful, especially with this person being so young. They were swollen all over and bruised before they even died. When the family showed up, they just talked over their body like it was a Sunday dinner. No tears or anything. The whole thing was a mess. Mother backed out of her driveway and didn't notice her toddler had crawled into the culvert under the road. The culvert collapsed and crushed her daughter. We tried to keep the daughter alive while the mother was hysterical and the father was in shock. That was the worst. I've seen worse graphically, but not emotionally. I'm a children's nurse. I worked on a ward that specializes in brain and spinal tumors in children, amongst other specialties. The worst thing I can think of was a little boy. I think he was 3 or 4 years old. He'd been in a different hospital for 2 weeks with a weakness to his legs that was seeping up his body, eventually causing incontinence. The other hospital hadn't scanned him. In residency, I took care of a young boy, less than 8 years old, with E. coli 0157H7. No one knows where he got it, and it wasn't part of a bigger outbreak. I'll never forget the screams of pain from the severe abdominal pain and bloody diarrhea. But then I'd go in a room to check on him, and when I asked him how he was, he'd just say in a weak little voice, "I'm okay," even when doubled over. Such a tough kid. There's no treatment besides supportive treatments, fluids. She was extremely obese, greater than 400 pounds, so it was too difficult to do her hysterectomy without first doing a paniculectomy, basically removing her pons, which is excess abdominal fat. A friend's stepdad was trained to be a nurse, so he got all the gross stuff that came in because newbie, a homeless man, came in complaining of stomach pains. When he told the guy to undress, he didn't want to take off his jeans. When asked about it, he said, "I can't take them off, my leg will fall off." Probably 6 or 7 years old, had some form of spinal cancer. My mother had met and talked to her a couple of times. On this particular day, she was excited because her dad was coming home from a business trip to Bali. This little girl was so happy because he was bringing her back a toy. The next day were the Bali bombings, which killed her father. She was distraught and spent the next 4 days just crying with little bits of sleep in between. Her mother spent most of that time with her daughter. About 2 months later, the mother passed away in a car accident while driving to the hospital to visit her daughter. So her grandparents got the duty of care for her, but she passed away 2 weeks later from the cancer. The poor girl suffered worse than I could think in her last 2.5 months of life, losing most of what was important to her before dying herself. I hope no one goes through anything like that again. My mother thinks she just gave up after her mother passed. This little girl lost everything just by some form of shit luck. My mother does leave flowers on her and her parents' grave every year on the anniversary of her death. Sometimes I really do not understand how my mother deals with being in ER. She is quite possibly the strongest person I know just because of that. Edit. Some words and an extra sentence.